You are sitting on the crinkly paper of an examination table. Your doctor walks in, looks at a chart, and says, "All right, time for your annual tune-up. Let's get you scheduled for a few routine screenings." You nod, you smile, you take the paperwork to the front desk without a second thought. Because why wouldn't you? You've been trained your entire life to believe that looking for medical problems early is the ultimate secret to a long, healthy life. But what if I told you that blindly accepting that paperwork is one of the most dangerous things you can do after your 70th birthday? I am Dr. Sam over the past 3 decades of specializing in geriatric medicine. I have been sitting exactly where your doctor sits, and I am breaking ranks today to tell you an uncomfortable truth that the modern medical machine desperately tries to ignore. Once you cross the threshold of 70 years old, the rules of modern medicine completely flip upside down. Preventative tests that were absolute lifesavers in your 40 and 50 suddenly become biological booby traps in your 70 and 80. Today, I am going to reveal 5 routine medical checkups that I would aggressively refuse if I were over the age of 70. But before I name the first test, you have to understand the invisible trap you are walking into. In the medical field, we quietly call it the intervention domino effect. When you are 45, your body is incredibly resilient. If a screening finds a tiny anomaly, you can handle the biopsy, you can handle the anesthesia, you bounce back from the surgery. But when you are 75, your biological reserve is different. The intervention domino effect works like this. Domino number 1 is a routine screening on a perfectly healthy, symptom-free older adult. That test kicks back a slightly abnormal result, which is incredibly common as we age. That knocks over domino number 2, the invasive biopsy or exploratory procedure, that knocks over domino number 3, a heavy-handed treatment for a problem that was never actually going to harm you, and the final domino, a catastrophic complication from the treatment itself. A healthy person walks into a clinic, and 3 months later, they are permanently disabled, not by a disease, but by the domino effect of trying to find one. We need to stop knocking over the first domino. Here are the 5 tests I would never get. Number 1, the routine asymptomatic colonoscopy after age 75. Let me introduce you to Arthur. Arthur was 77, an avid golfer, and the primary caretaker for his wife. He felt spectacular, but his primary care physician noticed he was due for his 10-year colonoscopy. Arthur dutifully picked up the massive jug of liquid bowel preparation. If you've had one, you know the nightmare I'm talking about. For a 50-year-old, spending 12 hours on a toilet emptying your bowels is unpleasant. For a 77-year-old, it is a physiological shock. Arthur lost so much fluid overnight that his kidneys went into acute failure. The profound loss of electrolytes caused his blood pressure to plummet when he stood up to walk to the bathroom. For the 15th time, he passed out, hit his head on the bathroom tile, and suffered a severe concussion. He spent 4 days in the ICU. The colonoscopy never even happened. The medical community already knows this. Major medical task forces explicitly state that routine colonoscopies for average-risk adults over 75 offer diminishing returns and rapidly increasing risks. The risk of the scope physically tearing a hole in the fragile wall of an older colon skyrockets, a bowel perforation in your late 70 often requires a massive emergency surgery and relying on a colostomy bag for the rest of your life. If you have no symptoms, no unexplained weight loss, and no blood in your stool, you do not need to risk a full invasive colonoscopy just to check. Ask your doctor about a non-invasive stool DNA test, like Cologuard or a FIT test. It requires 0 fasting, 0 explosive bowel prep, and it's done from the safety of your own bathroom. Number 2, aggressive routine cancer screenings like mammograms and PSA tests for the very elderly. I want you to listen to me very carefully because the cancer awareness industry has made this topic deeply taboo. I am not saying cancer isn't serious. I am telling you about the turtle and the rabbit reality of geriatric oncology. Imagine you have 2 animals in a pen, a rabbit and a turtle. The rabbit represents fast-growing, aggressive cancers. The turtle represents slow-growing, indolent cancers. If you leave the gate open, the rabbit is going to escape and wreak havoc. But the turtle? The turtle is moving so slowly that it will take him 20 years to even reach the gate. When we aggressively screen 80-year-olds for prostate and breast cancer, we almost always find turtles. Autopsy studies show that a massive percentage of men over 80 die with prostate cancer, but never from it. They never even knew it was there. But when a routine PSA blood test or a mammogram finds that tiny, slow-growing turtle, the medical system panics. I had a lovely patient named Helen. At 82, a routine mammogram found a tiny, non-aggressive anomaly in her breast. It was a turtle. It would have taken decades to threaten her. But the surgical oncologist insisted on a lumpectomy followed by a grueling course of radiation. The radiation permanently damaged the tissue in her chest, caused chronic, agonizing pain, and the sheer exhaustion of the treatment stole her independence. She had to move into an assisted living facility. We destroyed Helen's actual life to save her from a hypothetical future that was never going to happen. If you are over 75, before you let them screen for these cancers, look your doctor in the eye and ask, if we find a slow-growing cancer today, are we really going to subject my 80-year-old body to chemotherapy and radiation? Because if the answer is no, then I don't want the test. Number 3, routine electrocardiograms or cardiac stress tests when you have zero chest pain. This is the ultimate medical fishing expedition. You go in for an annual checkup, you feel fine, you walk 3 miles a day, but your doctor says, hey, let's just do a quick EKG or put you on the treadmill to check your heart plumbing. It sounds so incredibly responsible, but here is the dirty little secret of cardiology: in asymptomatic. Older adults, these tests are notorious for throwing false positives. They show a tiny, meaningless blip on the screen. Now the doctor is legally terrified. They can't just ignore the blip. So they order a cardiac catheterization. This means they are going to slice into an artery in your groin or your wrist and snake a long wire directly into your beating heart. This procedure can cause severe bleeding, artery damage, or even trigger the exact heart attack they are trying to prevent. And guess what? If you are 78 years old, you are guaranteed to have some plaque in your arteries. It's like having gray hair. It's a normal part of aging, but the moment the cardiologist sees that plaque on the camera, they deploy a metal stent. Now you are on aggressive, dangerous blood-thinning medications for the rest of your life. Massive multi-million-dollar medical studies, like the ischemia trial, have proven definitively that putting stents into patients with stable, symptom-free heart disease does absolutely nothing to prevent future heart attacks or help you live longer compared to just taking standard cholesterol and blood pressure medications. Let me be perfectly blunt. If you are over 70, you are breathing fine, and your chest doesn't hurt when you climb the stairs. A routine stress test is nothing but a gateway drug to unnecessary heart surgery. Number 4, routine bone density or DEXA scans. When I say this to patients, they look at me like I have 2 heads. But Dr. Aris, what about osteoporosis? Breaking a hip is a death sentence for older folks. You are entirely correct. Hip fractures are deeply tragic and often catastrophic. But we are looking at the problem through the wrong end of the telescope. When you get a DEXA scan in your late 70s, it is going to tell you your bones are thinning. Of course they are. You're human. The danger isn't the scan itself. The danger is the medication the scan forces you to take. The moment that scan reads osteopenia or osteoporosis, your doctor will write a prescription for a class of drugs called bisphosphonates, drugs like Fosamax. These drugs do increase bone density, but they do it in a highly unnatural way. They stop your bones from going through their normal, healthy remodeling process. Yes, your bones get thicker, but they become brittle, like chalk. I have seen older women on these medications simply step off a curb or twist in their kitchen, and their femur bone completely snaps in half. It's called an atypical femur fracture, and it is a direct result of the medication meant to protect them. Worse yet, these drugs can rot the jawbone, a horrifying condition called osteonecrosis. Do you know what prevents hip fractures better than any scan or chemical pill ever invented? Physical therapy, balance training, yoga, doing an audit of your house to remove tripping hazards and throw rugs, having your eyes checked so you don't trip over the cat. If your doctor pushes a bone scan, ask for a prescription for a balance and physical therapy program instead. Build your muscles and your bones will take care of themselves. Number 5, the routine carotid artery ultrasound. If there is one test on this list that keeps me awake at night, it is this one. You might have seen advertisements for mobile screening clinics that park at your local church or grocery store. They offer to run an ultrasound wand over your neck to check for plaque in your carotid arteries, the main pipes feeding blood to your brain. They market this as a stroke prevention screening. It is a brilliant marketing tactic, and it is incredibly dangerous. Let's say you get the ultrasound. You have absolutely no symptoms, no dizzy spells, no mini strokes, no blurry vision. But the ultrasound shows a 70% blockage in your neck. Panic sets in. You are referred to a vascular surgeon who recommends a procedure called an endarterectomy to clean out the pipes. Here is the horrifying reality. The plaque in your neck is essentially glued to the artery wall. It has probably been there for 20 years. It is stable. But when a surgeon goes in to scrape it out, they disturb the environment. Tiny pieces of that plaque can break off during the surgery, travel directly up into the brain, and cause a massive, irreversible stroke. I witnessed this exact tragedy with a patient named William. William was 76, a retired mechanic, sharp, funny, and deeply independent. He went to one of those pop-up screening clinics in a strip mall. They found a blockage. He had the preventative surgery. He woke up from the anesthesia paralyzed on the right side of his body. Completely unable to speak, the preventative surgery caused the exact stroke it promised to prevent. The highest medical authorities in the nation aggressively recommend against carotid artery screening for people without symptoms, because the data proves that surgical intervention harms far more people than it helps. Leave sleeping dogs and stable plaque alone. Now, I want to give you a tool to protect yourself. The next time a doctor casually suggests a test, I want you to use the PAERT protocol. PAERT P stands for pause. Do not agree immediately. Say, I need to think about this. A stands for alternatives. Ask, what is the least invasive way we can monitor this? R stands for ramifications. Ask, if this test finds something, what is the actual treatment, and what will that treatment do to my daily quality of life? T stands for time. Ask, what happens if we do absolutely nothing and just wait and see? A physician who genuinely cares about your well-being will respect the PAERT protocol. A physician who treats you like an annoyance on an assembly line will roll their eyes. If they roll their eyes, it is time to find a new doctor. Now, I must make one monumental distinction before we end this conversation. Everything I have just told you applies to routine, asymptomatic screening. If you are sitting at home feeling completely normal, do not go looking for ghosts. However, if you have symptoms, the rules change back. If you are coughing up blood, you need a scan. If you feel a crushing weight on your chest, you need an EKG. If your vision suddenly goes dark in one eye, you absolutely need your carotid arteries checked. Symptoms are your body's fire alarm. You never ignore the fire alarm, but you don't need to tear down the walls of your house just to check if the wiring is faulty when everything is working perfectly fine. The current medical system is built to intervene. It is built to bill for procedures. It is not always built to ask, will this actually make this person's final decades happier and more peaceful? You have the absolute authority to say no. You are the CEO of your own body. Do not surrender your independence just because a person in a white coat tells you it's time for a routine checkup. If this video opened your eyes, if it gave you the courage to take control of your health, please click the subscribe button. I dedicate my life to making sure you have the insider knowledge to protect yourself and thrive in your golden years. And before you go, I want to hear from you. Scroll down to the comments right now and tell me, have you or a loved one ever agreed to a routine medical test that ended up causing a nightmare of unnecessary treatments? Share your story. Your experience might be the exact warning someone else needs to hear today to save their life. Thank you for trusting me with your time. Stay strong, stay informed, and I will see you in the next video.